Hello guys, welcome to my YouTube channel. Today in this video, we are going to learn about Paroxysmal Nocturnal Hemoglobinuria, abbreviated as PNH. PNH is a rare acquired chronic intravascular hemolytic anemic condition with occasional or frequent recurrent exacerbation. It occurs because of the pyroxine mutation in hematopoietic stem cells. Pyroxine encodes an enzyme, glycan phosphatidylinositol (GPI), which synthesizes and anchors membrane-associated complement regulatory protein. The hemolysis is usually chronic with a dramatic hemoglobinuria, but in 25% of the cases, there will be abrupt exacerbation of the condition, mostly during the night, from which the name paroxysmal nocturnal hemoglobinuria comes. During sleep, there will be a slight decrease in blood pH, which favors the increase in activity of the complement and eventual red cell lysis. So the acidic environment of blood during the night is responsible for the increased tendency of blood lysis. Although the condition is rare, it has fascinated hematologists as it is the only hemolytic anemia caused by an acquired genetic defect. Now, let's talk about the pathophysiology. In PNS, there will be acquired mutation of the pyroxine in a hematopoietic stem cell. As the pyroxine encodes the enzyme GPI, mutation of this gene causes a deficiency of GPI enzyme in all clonal progeny cells, which result in absence of synthesis of membrane-associated complement regulatory protein, which regulates the complement system. These proteins are decay accelerating factor DF or CD55, membrane inhibitor of reactive lysis MIRL or CD59, and CD8 binding protein. Among these factors, CD59 or MIRL is a protein inhibitor of C3 convertase. So the deficiency of these factors spontaneously activates the alternative complement pathway, leading to complement associated hemolysis of RBC. Talking about the clinical features, the condition presents as a triad of hemolysis, pancytopenia, and venous thrombosis. Because of pancytopenia, patient may have other infection, bleeding, and fatigueness. Thrombosis is the leading cause of death in individuals with PNH. About 40% of the patients suffer from venous thrombosis, often involving hepatic, portal, and cerebral vein. About 5 to 10% of the patient may eventually develop acute myeloid leukemia or myelodysplastic syndrome, possibly due to sufficient damage in hematopoietic stem cells. The condition also shows frequent association with aplastic anemia, a marrow failure syndrome that has an autoimmune basis. Infrequently, a few cases may complain of passing of blood instead of urine, which is considered as the classical presentation of the condition. Now, coming to the investigation, blood profile shows a reduced level of hemoglobin and hematocrit value, normal or high MCV, but can be low in cases of iron deficiency state, and an increased reticulocyte count, which can also be decreased in the cases associated with bone marrow failure. The serum unconjugated bilirubin and LDH levels are elevated, while the serum haptoglobin is reduced, indicating intravascular hemolysis. Random urine sample shows overt hemoglobinuria. Bone marrow picture is usually cellular with marked to massive erythroid hyperplasia, often with this erythropoietic feature, but in some stage, marrow may become hypocellular or even frankly aplastic. The sucrose hemolysis test is used for screening purposes, which is not much reliable. Accredited serum test, also known as the HEM test, is the confirmatory test, but is carried only in few laboratories. Thus, the golden standard test for the diagnosis of this condition will be flow cytometry. Lastly, talking about the management, a patient can be managed with supportive treatment which includes blood transfusion, iron and folic acid supplementation, treatment or prophylaxis for thrombosis. Therapeutic use of monoclonal antibody eculizumab has shown an astounding effect. It has been effective in reducing hemolysis, transfusion requirement, and thrombotic risk. But the medication also carries risk of meningococcal infection. So all patients who are on eculizumab must be vaccinated against those capsulated organisms. Immunosuppressive drugs such as anti-thymocyte globulin and cyclosporine are sometimes found to be beneficial for those with evidence of bone marrow failure. The only definitive cure of the condition is hematopoietic stem cell transplantation. In quick recap, PNH is rare acquired genetic defect, occurs as a result of pyroxine mutation and subsequent deficiency of complement regulatory protein, leading to intravascular hemolysis. The condition gives the picture of hemolysis, pancytopenia, and thrombosis. It is confirmed with flow cytometry and is definitely treated with stem cell transplantation. Thank you for watching our video. If you like our videos, Please make sure to hit like, comment and subscribe our channel.